For most people, working up a sweat isn't necessarily a bad thing, but others suffer from perspiration so severe it disrupts their lives. Now there's a new treatment being tested here in the Bay Area to relieve severe sweating, perhaps permanently.
So that's what gives it that kind of softening look, I guess.
Filmmaker Tim Hicks spends much of his time directing horror films, so he was able to paint a pretty frightening picture of the problems he'd been living with for years.
I would have to go around like this, with my arms locked, at school or whatnot, because it would just constantly, if it was any type of anticipation or anxiety, I would feel it would just start to gush.
His excessive sweating was so debilitating, he finally turned to a new procedure being tested at a clinic in Palo Alto.
The goal is not to make somebody bone dry, as you say, but just get them from an exceedingly irritating, difficult situation into a normal sweating pattern.
Dr. George Commons has just finished initial trials on a wand-like device called a vaser. Originally developed to melt fatty tissue during liposuction, the vaser uses ultrasonic vibration to generate precise amounts of heat. In this video provided by Dr. Commons, he inserts the vaser through a small incision under the arm to reach the patient's sweat glands.
The ultrasonic energy basically translates into heat that then selectively destroys the sweat glands.
He says the goal is to destroy only a percentage of the glands to reduce perspiration without stopping it entirely. The machine generates measured amounts of energy, and surgeons can use different size tips to deliver it, depending on the patient's size and weight.
So the trick in the study is to do enough to discourage enough of the sweat glands so that relatively little comes back.
Studies have not proven yet if the vaser treatments will produce permanent relief, but results for patients like Tim Hicks have been encouraging.
It's normal now. Obviously I still sweat when I'm nervous, which is absolutely normal, but I'm not dripping wet. I'm not changing 2 shirts a day.
Now, researchers say the results achieved with the vaser are similar to what's now achieved by injecting Botox. That numbs the glands, but Botox needs to be re-injected. So